what is my patient care philosophy? Perhaps it starts when I first visited the University of Michigan Hospital when I was 16 years old to visit someone. And I remember it being a very, very large place, a very confusing place, and a place where I immediately got lost. And so when I came back later as a medical student and subsequently practicing here, I always remembered that feeling of being intimidated and lost here. And I really try to put a human perspective on what patients and families are experiencing when they come here to the University of Michigan health system. I'm really very simple in that I basically try to take a philosophy that I try to treat all my patients and their family members just like I would want to be treated or a family member would want to be treated. And I think at the end of the day, as long as you keep that perspective in mind, if I'm treating the patients the same way I'd expect, I think that really sums up what my underlying philosophy is. In obstetrics, we have lots of low-tech things and lots of high-tech things, and it's a double-edged sword that we can sometimes be accused of over-medicalizing obstetrics. And historically, you have to look back and remember that at one point in time in this country, everyone knew someone who had died in childbirth. And fortunately, that's a relatively rare event these days, and that's not necessarily the way it is in much of the world, unfortunately. So we try to take an approach where we have the technology available, but don't use it unless we need it. And because in obstetrics, one intervention tends to lead to another, and if you need the technology, great, and if not, then actually try to default to more of a midwifery mode where it's let the mom do her thing and not use the technology unless it's needed.